In Fox 5 Health News, the Surgeon General urging more people to carry a drug that can reverse an opioid overdose.
All right, joining us now, Fox 5 medical contributor Dr. Debbie Nampia-Parampil from the NYU School of Medicine. So, it's a crazy sign of the times, but the reality is this can save someone's life, and there's a lot of people on opiates right now.
Exactly. So I'm a pain management specialist also, so I'm in favor of people having more access to naloxone. So the idea behind this is that it's an auto-injector or a nasal, like a spray. So basically you could use it, anybody could be able to use it to save a life. And so a lot of pain management specialists feel like if you're going to prescribe any opioid, whatever field you're in, for postoperative pain, for any type of pain, why not also prescribe the patient this antidote as well? So the idea is not that they might necessarily need to use it, but let's say their kid gets into their medications, you know, maybe a toddler, a teen, or somebody around you has some kind of problem. Instead of having to call 911 and wait however many minutes for some help to arrive, that you could actually do something and potentially save a life.
Now, how do you get this is it naloxone? That's really what it is.
Exactly, yeah.
So how do you get it? How much is it?
Well, so it's available at the pharmacy. Emergency responders have it, but you could get it at the pharmacy, and some public health groups or public safety groups have it also. So it depends on your insurance. I mean, most insurances will cover it if you are also taking opioids, and also if you have an interest.
Could anyone go into CVS right now and buy naloxone?
For the most part, you need a prescription, but there are some places where you could say you're at risk and maybe have access to it without a prescription, so that's a possibility, but it kind of depends. And then the pushback against it, because from my point of view, it's like, why not? Why wouldn't you have it available, right? But the pushback against it is that if someone prescribes the medication, the antidote, along with the opioid, then does that person think there's already a risk and is encouraging the person to be a little more reckless with the medication?
It's more preventative, if anything. Now, let's say you do have naloxone, and my big question is, you know, you're on the subway and you see somebody. How do you use it? What do you do? Well, and how does it keep? And how do you prevent it from spoiling?
Well, so it's an auto-injector for the most part. So you don't have to refrigerate it. You could just have it with you. I mean, so depending on what formulation you have, you just inject it kind of like an EpiPen, or you could give the person a spray. Now, most places have a Good Samaritan law. So if you happen to inject it, let's say by accident to somebody who was having a different problem, you should be safe. Most states say that. But the risk of giving it to somebody is relatively low in terms of, you know, if the person's never been exposed to opioids, so let's say a child, a toddler, or something else, and they accidentally got into it, the risk is pretty low. You're just reversing the effect of the opioid, which they shouldn't be taking anyway. Now, if you have someone who just had surgery, for example, and you accidentally give them the naloxone, it'll reverse their painkiller. So they may suddenly have more pain.
Oh, yikes,
They, you know, they may start to vomit, but at the same time, it's better than potentially dying, right? So this is a safety measure.
All right. Story 2 here. Lin-Manuel Miranda is battling shingles. The Broadway star says at first he thought he had a migraine. This sort of thing, if you had chickenpox, you could get shingles as an adult, right?
Exactly, yeah. So it can be very painful, not in everybody, but for the most part, it's like a resurgence of the chickenpox virus, and usually it's not all over the body like chickenpox. It comes in a specific nerve root distribution. So meaning if it's in the face, it can come across the eye.
That sounds horrible if he thought it was a migraine.
Yeah, and the danger there is it could affect the eye, so people can lose their vision. So it's actually very dangerous in that respect, permanently. But most people, for the most part, even, you know, people who are not at risk can get it as well, and it usually appears as a rash, but sometimes you can have this pain sort of over the torso. It's usually almost in a ring, so over the torso or the belly, and usually accompanied by a rash, but not always. But if you do have it, it's important to reach out to the doctor. I would say maybe by phone first, because there are some medications that can help speed the resolution. And the reason I say phone first is if you have it and you're near someone, in contact with someone who's never had chickenpox or the vaccine, they can also get it too. So even at the doctor's office, you know, if you have an older or pregnant or, you know, a receptionist who's never had chickenpox.
From his kid to make sure the kid didn't get it and whatnot. All right,
you definitely want to keep distance and be careful.
Dr. Debbie, we appreciate it.
Thank you.